This is the dressing skill. We don't have any supplies to bring into the room because everything is already here. One consideration is that our resident has an affected side. So his left side is affected, and so that's going to determine the order that we take off his gown and we put on his clothing. So let's get started. Knock, knock. Hi, Jerry. My name is Cindy. I'm going to be your aide today. I'm here to get you dressed. Is now a good time? And he says, yes, it is. I'm going to sanitize my hands, rubbing until dry, and I'm going to close the curtain for privacy. Let's lock the brake on the bed, and I'm going to step aside for a moment to go to my resident's closet and bring out some clothing choices for him. I'm going to ask my resident if he'd prefer the gray shirt or the blue shirt, and he says he would prefer the gray. So I'm going to remove his clothing from the hanger, set that aside. He's going to go with the gray shirt and the gray pants. I'm going to return all of this to the closet, and then when I return to the bedside, we'll get started. I'm going to move this down to the foot of his bed. His affected side is his left, so I'm going to undress the unaffected side first. I'm going to raise his bed after I get his gown off. I'm going to provide some support and untie his gown. I'm going to undress this unaffected side first, and I'm going to keep him covered for privacy and dignity. Now I'm going to walk around to the other side of the bed, and I'm going to undress his affected side. And I know you can't see what's going on under the sheets. So I'm going to roll up the used gown and put it in the hamper. Next, I'm going to get his long sleeve button-down shirt, and I'm going to put on his affected side first. I'm going to reach through the sleeve and gather it up. I'm going to grasp his affected hand and gently guide the shirt over his hand. And now I'm going to assist the resident, crossing the ankles, to roll over onto that side. Before I do that, I'm actually going to raise the height of the bed so I don't strain my back. I'm going to help roll over onto the side on the count of 3. 1, 2, 3. I need to keep my resident covered as much as possible, but I'm going to make sure his shirt is all lined up the way that it should be. That means I'm going to have to tuck some of it underneath. Okay, we're going to roll back. 1, 2, 3. Again, making sure that his chest is covered as much as possible. I'm going to walk around his bed. I'm not leaving his bedside. And we're going to come over to this side. Again, I'm going to assist the resident to cross the ankles the other way and roll over onto the side. 1, 2, 3. Cover up for privacy and dignity. I'm going to make sure that the shirt is straight with no wrinkles underneath. And again, on this side, we're going to gather the shirt and grasp his arm in his hand in such a way that I can help him guide his hand through it without injuring his fingers or pulling on them. We make sure that his collar looks right and this is nice and straight, and I assist my resident to roll back onto his back. I have to button all of the buttons on his shirt. Provide support wherever necessary to make sure everything is all lined up. I like to start at the bottom of the shirt, buttoning all the buttons. The only button that is optional is the one closest to his neck. And we also have to button the buttons on the cuffs as well. So this has to be a long sleeve shirt. And sometimes it takes a little bit of practice to really get to doing this fast. He says that he doesn't want the button closest to his neck done. Moving on to his cuffs. We'll take care of that. And we just have to make sure that we have the shirt straight without any wrinkles. He doesn't mind if I reach across just to do the cuff here. Next, we are going to make sure everything is all lined up. If I buttoned anything crooked, I can fix it at this time. Next, I'm going to help him with his pants. Again, we have to put on his affected side first. So I'm not leaving his bedside. We're going to keep him covered as much as possible. Again, just like the shirt, we're going to gather the pants and reach through and assist his foot to go through his pant leg. And we'll do the same thing with his unaffected side as well. And maybe he can provide a little bit of support, or maybe he can't. Once his pants are about to his knee height, again, we can start rolling side by side again. I'm going to assist my resident to cross the ankles, roll over to the side on count of 3. 1, 2, 3. Providing privacy, we're going to assist him with pulling his pants up over his hips. Again, making sure that his shirt is straight. I'm going to roll back onto his back, uncross the ankles, and go over to the other side. I'll walk around, not leaving my resident unattended in bed. And again, on this side, I'm going to help pull those pants up over his hips. I'm going to make sure everything looks straight and it's pulled up as high as it should be. Looks like we need to roll again. 1, 2, 3. Make sure this is all pulled up. No wrinkles. No twisting. Everything looks nice. We're going to roll back. 1, 2, 3. Once he's on his back, we're just really making sure everything looks comfortable. Let's put on his socks now. And there's no specification that we have to start with the affected side with the socks. We can do either one, but with the shirt and with the pants, we start with the affected side. We're going to gather the sock, put it over the toes, over the heel, over the ankle, and we guide it straight up. No cuff, no wrinkles. These are a little bit big for him. We can reach across our resident for this one. Again, gathering the sock over the toes, over the heel, over the ankles, straight up, no cuff, no wrinkles. We're going to provide support for his legs. Make sure everything's all straightened. He says that feels comfortable. He looks nice. And so I'm going to cover him back up. If I have any corrections that I need to make along the way, I just make a correction. This is not a bed making skill. We're just trying to make him look comfortable. I don't think I have any corrections that I have to make. So I'm going to put the height of his bed down. We would never leave his bed in a high position for his safety. I'm going to make sure that I do my 3 L's. The bed is low, it's still locked, and I have to put his call light in his unaffected hand, which is his right hand. I'm going to ask him if he wants something to drink, and he says, no, thank you. So I'm going to open his curtain, perform hand hygiene until dry, and say that I am done.